Welcome to the last breakfast. Please enjoy the video.
You start immediately by cleaning. Wash your scalp, then sanitize the roller and your hands. This prevents infection. Once done, section the scalp into 1-inch zones so you can track coverage and avoid overlap. Make the first actionable pass with a 0, 25 to 0. 5mm needle, press firmly but not painfully. Roll 4 times per zone, vertical, horizontal, then both diagonals to create uniform microchannels. As you work, keep movements steady and controlled so skin reacts evenly, and you build a consistent foundation for serums. Once the initial passes are complete, pause briefly and assess the scalp for pinpoint redness. You should see mild erythema but no heavy bleeding. Then apply 2 to 3 drops of your chosen topical serum directly to each treated zone. The microchannels increase absorption, which is why timing matters. Make additional gentle passes if needed, but rest 10 to 15 seconds between passes to avoid over-traumatizing tissue. If treatment lasts over 10 minutes, resanitize the roller so you maintain a sterile environment. To finish, apply a soothing, non-irritating serum to calm inflammation and lock in the growth factors. Make sure the scalp stays protected and avoid sun exposure and harsh shampoos for the next 24 to 48 hours. Clean the roller with alcohol, let it fully dry, and store it in a clean case. Replace the head per manufacturer guidance. If you notice excessive bleeding, spreading redness, pus, or worsening pain, stop immediately and consult a clinician. This key troubleshooting step prevents complications and tells you when to pause the protocol.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.